Hi there, my name is Hannah Daly, and I'm a professor of mechanical engineering at Lehigh University in Bethlehem, Pennsylvania. And I'm really excited to be recording this video today because I love the Perry Initiative, and I'm really excited to tell you a story about something that I do for my research as a professor. I study orthopedic biomechanics, and today in this presentation, I'm going to be telling you about something we do in my lab called virtual mechanical testing of bone healing. So you probably know somebody who has broken a bone in their body. Maybe you've broken a bone in your body. One of the most common bones that tends to get broken is the tibia, which is the shin bone. There's actually two bones in the lower leg, but the tibia is the big one. If you reach down and you touch your shin on the front of your lower leg, that's your tibia that you're feeling. Now I'm going to show you a couple of pictures right here. And if you don't like gross things, you might want to close your eyes just for a second on this slide. But here are some examples of athletes who got tibia fractures while they were playing their sports. And I'm going to tell you the good ending to their story for all three of these athletes is that they had a surgery to fix their broken bone, and they all made a successful recovery and return to playing sports. So it doesn't have to be the end of a person's life when they break a bone. Typically, what we look at for the healing of a shin bone fracture would be a series of x-rays. So in this case, we have a patient, this is a 32-year-old guy who broke his leg because he was playing sports and he got kicked in the shin during the game. So this is a good reason to wear your shin guards, right? So this patient had a surgery right after they broke their bone, and we can see inside of the bone of this patient, we can see that an implant was put inside to stabilize the fragments of the bone. And an orthopedic surgeon does that job. And then after the surgery, the patient can get up and start to move around gently. And then over a period of weeks and months, the bone starts to gradually heal itself. So here we have some x-rays that were taken of this patient 6 weeks after their surgery, and 12 weeks after their surgery, 17 weeks, and 23 weeks. And in the picture from 23 weeks, what we can see is that the bone has healed itself by forming a bridge of new tissue. And that new tissue is really special. It's called callus. And its job is to stabilize the bone fragments so that they stop moving around. And then gradually it becomes bone itself. And if you wait long enough, that bump that has formed, and if you ever broke a bone, you probably could feel that bumpy spot on your bone for a while afterward. Eventually that goes away. So it's this really amazing process that the body does to put broken bone pieces back together again and let them start doing their job, which is bear loads while the person is walking around and doing the things that they enjoy doing. Now, sometimes patients have a problem with their bone healing, and it might be slow or might not be going the way that we want it to. And it would be really useful to know whether that's happening early on in the healing process so that the surgeon could make a good decision about whether this patient needs more treatments. So in my research group, we're a bunch of mechanical engineers, but we developed a technique for using images that can be taken of the patient, 3D images called computed tomography or CT. Sometimes they're called CAT scans. That means the same thing. We take these 3D images like an X-ray through the bones, but it makes a 3D picture. And then we can put them together to make a virtual model. And once we build this virtual model, we can identify the old bone that was there before the patient broke their leg, and that's what you see in gold on this picture. And we can identify the new bone that is forming, and that's what you see in red. So we put this all together, we make a 3D model, and then we want to do what we call virtual mechanical testing. Now, I can't take a patient's leg and take it out of their body and put it on a mechanical testing machine and measure how strong it is. So I need a computer simulation that can do that job for me. So what I have here is this virtual model. It's an exact representation of this patient's leg, but I never need to touch the patient to do it. And once I have this virtual replica of the bone, then I can use a computer to simulate putting loads on it like a patient might, or we can really put any load on it that we want to. And what makes this so cool is that inside the computer simulation, we can actually change the mechanical material properties of the bone and of the new tissue that's forming. And in this picture, you can see that part of the tissue looks like it's tan in color, and that would be really hard old bone. And part of the tissue looks like it's blue in color. It's not really blue inside the body, but we just color it that way in this picture so that you can see that there's a difference. The hard bone is stronger and the blue bone is softer. So now what can we do with this technique, right? We know how to take the 3D image and we know how to put it together and make a model. And then what can we measure that might be interesting to a surgeon? So this is one really cool experiment that I got to do in collaboration with some orthopedic surgeons. And we were interested in whether or not certain kinds of health risk factors can actually hurt bone healing in a measurable way. So to do this, we did our virtual mechanical testing technique. So we got CT scans of a bunch of patients who broke their tibia or their shin bone, and we tested their bones during the healing, and that's what this picture is in the middle here. And we tested them, we kind of put the Lego pieces back together and we tested them in an intact state. So then we can get this percentage score that tells us whether a patient is all the way healed, that would be a score of 100% or sometimes even higher than 100%, or if they're not healed yet, and that would be a low score, like maybe 20%. So we're looking for patients to be up at around the 100% dashed line because that means that their leg has recovered its mechanical ability to hold up their body weight, and that's really what we want. So now in this experiment, we had two groups of patients. We had a normal group, and they didn't have any kind of health risk factors that the surgeons knew about. And then we had a group that did have health risk factors. And after our experience, everyone's experience going through the COVID-19 pandemic, we're all a lot more familiar with the idea of health risk factors. So these would be things like for bone healing, like smoking and diabetes. They're things about a person's health status that put them at increased risk for having a problem if they get another kind of illness or injury. So we know that smoking is bad for a lot of reasons, but we want to know whether or not it's particularly bad for bone healing. We want to measure whether a bone heals more slowly in a patient who smokes compared to a patient who doesn't. So that's what we were able to test with this virtual mechanical simulation technique. So this data here, it looks like a little box with these lines sticking up out of it. What this represents is all the patients that we tested. So the box represents kind of the middle 50% of people. So most folks are going to be inside that box. And as long as the patient doesn't have any health risk factors, then by 3 months after their surgery, they're at around 100% for their healing score. So that's great. They're doing great. And those patients are typically ready to start doing their regular activities that they love again. And that means they've had a successful healing outcome. Now, if we compare them to patients who have some kind of risk factors like smoking or diabetes, there's something about their biology inside their body that puts them on a slower pathway to healing. We can actually measure how much slower that pathway to healing is. And in this case, for this group of patients, we found that it was 23% lower healing scores in these patients who had health risks. Now, you guys are smart. You know that 23% lower is lower, right? And so what this tells us is that we can use an image that's taken of a patient. We don't need to touch their leg. All we need to do is take this image. We can rebuild a virtual representation of that person's bone. We can test it using a computer simulation and know how healed it is. And we can use that kind of simulation-based method to do really cool research that you can't do any other way, like asking, do patients who smoke or have diabetes, do they heal more slowly than patients who don't? And that kind of information is really useful to orthopedic surgeons. And so I'm excited to be working as an engineer on these kinds of tools and techniques because it lets me bring my knowledge, my skills, my things that I do well as a mechanical engineer into the practice of an orthopedic surgeon and be able to help her or him do a better job of taking care of patients who really need it. So that's my research. That's one of the projects. I would encourage you to always think with a really broad and open mind about how engineers and doctors can work together, particularly in orthopedics, to be able to solve problems that are really important for the patients that we all want to take care of. Thank you so much for listening. Bye.